Alright guys, Dr. Tom, and Friday afternoon. Going to do a quick show and tell of one of the gadgets we have here at Apollo Cardiology, where we help people not have heart attacks so they can lead the lives that they want to lead. So today I want to chat a little bit about a cool device I'm playing around with called the Careware Patch. I got one on currently, and I'll wait for a few people to come on and then we'll start chatting about it. So hopefully you guys are all staying nice and warm today. I know it's like -2 here in St. Louis, but do it anyway. Go out there and see the sunrise, get that right frequency in your eyes during the day to set the circadian rhythm, and then you can use these fun photobomb modulation toys to kind of augment what the sun is lacking this time of year. So today I wanted to chat a little bit about this device I got on my wrist here called the CareWear. The CareWear is a LED patch system for photobiomodulation. So this is what one of the patches looks like. It has these little printable LEDs that will light up different red and blue frequencies of light. The blue is useful for pulsing nitric oxide, and most of the time that these patches are used are for musculoskeletal injuries. So, you tear your bicep or tricep, or you have a major bruise on something, get one of these patches, has a little sticky back onto it, stick it on whatever hurts, and then there's a little battery pack that you charge up with a this provided USB charger, and it powers it up for a 30-minute trial or cycle, I should say. And there's like little blue dots that are flashing on the periphery of this thing. Each one of those dots is for 5 minutes, and when it gets to the end, 30 minutes is up. And you can probably, I'll flip it around here, you can see it's somewhat kind of lighting up on the other side there. So I applied it to my wrist because it's then radiating the blood over my radial artery. The radial artery provides blood flow to the upper extremity, but you can access your entire cardiovascular volume through this access point. So in my old days, as an invasive cardiologist, this is where we would throw the catheters up and go up into your heart and take angiograms or pictures of the heart arteries. But when you put the light directly over the radial artery, you can get those light frequencies directly into the red blood cells, and those red blood cells act like little ferry boats to take the light energy to where it's needed. The interesting thing is with the blue frequency of light, it may be able to pulse nitric oxide, which in the cardiovascular world can help with arterial dilation. But nitric oxide also has like Teflon, prevents stuff from sticking to the arteries in the first place. So nitric oxide is extremely important for cardiovascular health. And so I had some ideas on how this device might help patients with hypertension. It's not been shown in any trials yet, so I'm kind of biohacking this one on myself first to see how it works. And then maybe some patients here at Apollo Cardiology want to try it out, and we'll let them play around with it. So photobomb modulation, for those that are new to it, it's just how do you use light devices to modulate your biology. So most of the time the wavelengths of light are going to be red or infrared. Most of the other wavelengths are just so short that they're not going to penetrate the skin very well, and so you're only going to get kind of like a topical effect. So personally, I don't know how much of the blue actually gets in, so like I said, I'm going to play around with it on myself first. But I have noticed if I do this and then check some of the devices we have in the office, the Max Pulse or the Accor, the 24-hour, I should say the central aortic blood pressure monitor. My central aortic blood pressure is extremely low, and the arterial elasticity is outstanding. So what I'm going to do for some patients is have patients who have numbers that aren't so optimal, have them do a round of this 30 minutes on their wrist while they're sitting here in the office, and then take them back in the room next door and do the testing on them, see can the arteries improve in that short period of time. So if the answer is yes, then maybe this is something you want to use, once a day at home, just as a maintain phase to optimize your nitric oxide levels. Mine kind of races. Nitric oxide is extremely important for the other ED, other endothelial dysfunction. So, could this be used for erectile dysfunction? Possible. I don't think any trials are yet going with it, but anything that boosts nitric oxide, tends to help with arterial health. So, I may reach out to some people who are interested in that biohacking kind of technique, and maybe they can tell me if it's working for them. So I wanted to share that's kind of how I'm playing around with it today. The devices are available to the general public. You can get it directly from the CareWear website, and they have these different size patches. So this is a medium-sized patch, and the other one I got on me is a small patch right now. But typically you just slap this on whatever is bruised or injured, plug in the little light battery, and turn it on. Goes for 30 minutes. You do 1 or 2 sessions a day until whatever injury is healed up. So, but So far, I've not fortunately been injured myself. I did know somebody who tore their tricep, and they were using it to decrease the swelling and the inflammation before they had surgery. Seems to help them out. And then there's some other things that probably going to be banned talking about it, but those devices potentially have some benefit at eradicating viruses. So, but somebody's asking a question here. Is any contraindications to the school device like stents? No, shouldn't be. You know, if you already have a stent, that already indicates that at some point you had endothelial dysfunction to have the arteries get scratched up, and the stent was just deployed to keep the artery open. So cardiac patients are probably the best patients to consider these type of devices. Again, this device is mostly marketed towards people with musculoskeletal injuries, but once something's been released to the market, the biohackers get their hands on it, they figure out other interesting uses for it. And when I heard that it boosts nitric oxide, I immediately thought, like, well, I can help people with high blood pressure, erectile dysfunction, coronary artery disease. So I reached out to the company and bought a couple of these devices and been playing around with them, and I'll start letting some patients play around with them as well. But yeah, you can acquire them directly from the website if you're interested. If you're local here in St. Louis, I can basically sell you the patches, and I'll rent you the little battery packs if you really want to play around with it. So just wanted to jump on here quickly, 5-10 minutes on Fridays, go through a show and tell of the device that we use here at Apollo Cardiology to help people know what the risk of a heart attack is and how to mitigate those risks. So next week, we'll do something I'll do the max pulse next week. Last week, we had done the carotid intimal medial thickness scan. Good news, my arterial age is much younger than my biologic age. So I'll keep showing you guys how it's done, and have a great weekend, and see you next time.